Good evening, I'm Andrea Anderson. Brian Allen is on assignment. Nationwide, syphilis cases are on the rise. Rates are up across all ages, with South Dakota being near the top in cases per capita in two specific areas. Medical professionals now warning people to watch out for this infection, especially when it comes to children. Cooper Seamer has more in our top story here at 5. Cooper.
Yeah, Andrea, South Dakota sits at the top of primary and secondary cases in women of childbearing age and number 2 in congenital syphilis cases, which deals with infants. Syphilis is a growing concern all over the United States. That includes South Dakota, where trends are going in the wrong direction of where health professionals want them to be. Dr. Ashley Sands specializes in pediatric infectious diseases at Sanford Health. She says more accurate testing shows that this trend has been going up since the start of the COVID-19 pandemic, affecting not just adults, but infants.
Our syphilis rates all over the country have really skyrocketed over the last 3-5 years. And with that comes an increase in congenital syphilis.
Those rising numbers aren't spread across the state evenly either, with Native Americans seeing the largest increase in congenital syphilis.
Whereas it's 1 in 275 births across the state of all races, it's 1 in 42 of our American Indian population.
Sands wants to make people aware of the growing health concern and wants people to know that syphilis is easy to treat in adults, cutting down on the risk for infants.
You can be tested very easily. Anybody can go to their physician, their family clinic, and get a simple blood test. And then it's treated in adults very easily.
Access can be an issue, especially in rural areas of the state. But Sands says there are other options for getting treatment for syphilis than just going to a clinic, which can be difficult.
I know it's difficult to get in. There are fewer clinics. But there are ways to not just go to your family clinic, but there are other very quick point of care testing that can be done.
Sands says that infection takes a toll on an infant and can lead to major complications and sometimes death. Treating it in infants is also much more intensive, so she says acting early to treat it in adults is what they're pushing for.